I always viewed our eyes as just like gateways of telling our story. They hold our memories and they do guide us as individuals. And through them, that's how we actually connect. We like learn, we create, and we like get to dream. My background started in public health, actually. And I learned to see health not just as individual care, but as like a collective responsibility, like to equity, prevention, and access. Caring for vision isn't just about treating a person's eye. It's about actually understanding the person as a whole. And that perspective actually led me to where I am today, the intersection of clinical care and public health, where vision care is more about just an exam or treatment to me. It's actually a form of advocacy, whether it's from like a newborn who has early screenings to elderly eye care, from preventing avoidable blindness to addressing health disparities in underserved communities. I've always seen vision care as both a personal mission and a public health necessity. And, you know, the irony is what started off as a profession has kind of become a calling. Access to eye care from the very first day of life to like our 90s and beyond, it's extremely essential. So without it, vision doesn't just affect sight, I would say. It perpetuates the cycle of inequality that we were talking about. So the best example is like a child who can't see the board will always be mislabeled with a behavioral issue, and they're gonna fall behind in school. Or let's say an elder with like preventable like blindness, what's gonna happen is that they're gonna be isolated from their family or their community, right? And when someone is diagnosed with a disease, whether it's glaucoma or diabetic retinopathy, it's not just medical, it can bring aspects of like grief, anger, frustration. And like what I always feel is that with education, with early detection and access to care, people can be prepared, protected, and supported. And eye care will always preserve that independence, and it strengthens that opportunity and safeguards that quality of life. When you hear stories of people who have to travel like hundreds of miles to just get like medicine or have their child seen or taken care of, and like all these people are losing their vision, and it's like literally avoidable or treatable, even with a pair of glasses or just like an eye drop or just having a regular check, you start to realize the role that you can play. It's ignited a passion within me where it's like, I don't want to settle for less, where it's like, I want to do more and create avenues for people. So those people realize that there is like hope and faith in the world, and that they aren't forgotten, and that they can carry on and do more, because you never know how your connection with someone can impact them. And I just believe in like literally that love will always heal the world, no matter what's going on. There are so many nonprofits, like if you think of one site from Esler, you think of Prevent Blindness, you literally think of like International Agency of Preventing Blindness. And I think that's such a huge component. Loving your eyes is like really means appreciating the daily gift of vision and adapting habits that allow you to keep that beautiful gift, like regular checkups, wearing protective eyewear, and just having healthy routines.